Adult congenital heart disease is a growing field where young adults who were born with congenital heart disease are now surviving and getting into the adult world. There are more adults with congenital heart disease than children with congenital heart disease. And that in itself is a testament to the success of pediatric cardiology, that these kids who were born with congenital heart defects are now surviving.
Because we've done better and better every year at saving children with heart disease, both with medicines and procedures, we have an upside down pyramid, so that while the rate of birth for children with heart defects is constant, the majority of them are over the age of 18.
What this also means is that adult congenital heart disease is now numbering right around 1.5 million adults with congenital heart disease. That's a staggering number.
Here at Montefiore Medical Center, we've created a division that focuses just on patients who are adults who were born with congenital heart disease, who had therapy, or who didn't have therapy. We have cardiologists and surgeons who specialize in taking care of these patients who have unique problems that typical adult cardiologists and typical adult surgeons are not overly familiar with. And Dr. Zaidi is part of that team. He's double-boarded and exquisitely trained in both how to take care of children with heart disease and adults with heart disease.
It's, in the pure sense of the word, a multidisciplinary team. There are multiple people involved.
We as pediatricians take care of patients up until they're about 21 years old, and then we have to transfer them over to our adult colleagues. That transition period, that time where they move from the pediatric care to the adult care, is a very important time in their lives. A lot of things are going on in general for them, often leaving their homes, becoming adults, getting jobs.
There are very, very few programs in the country that allow that seamless transition. In Montefiore, and the Children's Hospital at Montefiore allows that transition. It's not so much about medical care, it's about the readiness of the patient to embrace the world of adult medicine.
So that is an example of how you have to have a nice collaboration between pediatric caregivers and adult caregivers. And we emphasize that a lot at Montefiore and the Children's Hospital.
When we think about procedures and we think about what's needed, we will sit down weekly in a combined conference and we will discuss the case of each patient. And in that case management conference, there will be the cardiologist, there will be the pediatric cardiologist, there will be the adult congenital cardiologist, there will be the CT surgeons, there will be the cardiac anesthesiologist, there will be the interventionalist, there will be the electrophysiologist, and there will be the imagers. So everybody sits around a table and everybody discusses the case, and then everybody gives their input, and then we reach a decision as to what is the best modality of treatment that we will provide for this patient. And what that means is that we can individualize treatment to each patient. And that's a very, very important caveat to the success of the treatments and the success of surgical procedures that we can then provide to each patient.